Hi, welcome to this unique haircare initiative by IBCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle age problem when you used to lose hair or have bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Daniel Henry. He is a well-known dermatologist and has been practicing medicine for over many years now. His M.B.B.S. M.D. specialized in dermatology, cosmetology, and trichology. Currently, he is practicing as consultant dermatology at Usha Memorial Skin and Eye Hospital, Bilaspur. Doctor has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient education and awareness about hair and skin care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer
Most
the question
welcome.
hair care for us today. So,
Thank you.
Doctor, today we are going to talk about hair care in current scenario. So, whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, irrespective of gender and age, is hair loss. So, with your profound experience, can you please enlighten us? What is hair loss and what's normal and when to be concerned for?
See, regarding hair loss, it's like what we say the common thing is when the patient notices hair loss is a patch. Whether there is some loss of hair at one side or there is a bald patch, and the hair loss is common in males and females both these days. And I would say that according that to explain patients like what is hair loss is like if you are losing like around 100 or more hairs in a day, then
Mhm,
it's called it's considered abnormal. But if you are using losing like 5 to 6 hairs, 10, 15 hairs like daily, it's normal because when these they shed, then the new growth comes. So now hair loss can be due to various factors like genetic factors or diet or different hormonal imbalances, uh, low hemoglobin, low blood count, or
mhm,
due to any disease, post surgical or
mhm,
post pregnancy, which cause post pregnancy hair loss is very common. Then
mhm,
after any disease like during the pandemic we were seeing like a lot of hair fall after COVID-19.
mhm,
So that these are the various causes and various types of hair loss, but the mainly we have divided in this like I would be using some of the scientific terms and I would be explaining it. Like there is a telogen effluvium, which we were talking about before. So
mhm,
then, because the hair goes in three cycles, that is anagen, catagen, and telogen. So
mhm,
telogen effluvium is due to the disturbance in the hair cycle. In common terms, I am explaining.
mhm,
So, and this can be due to the post-surgical or due to any diseases or due to any nutritional deficiencies. Like
mhm,
vitamin D deficiency is very common in India, or
mhm,
zinc deficiency, or due to low hemoglobin. Whereas we see androgenetic alopecia due to androgens. These are male androgenetic alopecia and female androgenetic alopecia, both. Male androgenetic alopecia is usually like hereditary type
mhm,
of alopecia,
mhm,
meaning if the father is having hair loss, the son would
mhm,
also have the bald patch, and
mhm,
that is because of the male hormone, and that
mhm.
is hereditary. So these are few types of hair loss, the common type.
Mhm,
Otherwise, we have this alopecia areata, where there is only a single patch or sometimes multiple patch.
mhm,
That is an autoimmune type of hair loss. And then
mhm,
there is a trichotillomania due to some psychosocial issues or stress. The people are they usually children, is teenage children, and these college going, or the housewives, they try to pull their hair
yeah.
sitting when they are in stress, so that's called trichotillomania.
Mhm,
So there are various causes and various types of hair loss. I
mhm,
have just explained some of the common causes and of hair loss which we see in day to day or in our clinic.
mhm. That's very interesting, doctor. So now, doctor, we know what's hair loss, what are the causes. Another thing is like our lifestyle is like it's very hectic and we work late night. So does person's lifestyle play any role in hair loss?
uh, Definitely, because in these days, like because you need to have like people don't have a common right sleeping schedule
Hmm.
or proper diet also, that's causing the nutritional deficiencies. And because of the this fast food culture and late night parties in metro cities and even in smaller cities these days, people are not getting enough food, enough supplement for the hair. People are
Hmm.
not getting enough sleep, and that
Hmm.
is somewhere affecting the growth of hair, and that is somewhere affecting hair loss.
Hmm.
What we see is, if we go back, if we think like 50 years ago or
Hmm.
maybe less than 20 to 30 years ago,
Hmm.
hair loss was not such a big problem. Now
Hmm.
these days, everyone from the teenage to the adult to the old age, everyone has hair loss.
Yeah.
So that is somewhat, I think, because of the lifestyle which we are having,
Hmm.
and that is affecting our hair as well as our body also.
Hmm. Yeah, that's true, doctor. So lifestyle play a major role not only in other disease form but also in hair loss and for also skin.
Yeah, because there are certain hormones involved, and like when we sleep, there is secretion of melatonin.
Mm-hmm.
So or so that is somewhat affecting the growth of hair.
Mm-hmm.
So I would say that proper sleep is really necessary to for hair growth, also to reduce stress and to keep the body healthy.
Okay. That's very interesting, doctor. So, doctor, in this era of information, like there are so many information on internet, and also while traveling, there are posters where they claim like 1000 rupees mein pure baal aa jayenge. So there are so many information, so people are quite confused and they really don't know what to do and what not to do. So, can you please
Mhm.
enlighten us today with this platform? Like, what are the actual medical treatment options available for hair loss, like topical, surgical, or any other form?
Yes. So first thing, 1000 रुपए में hair में कुछ नहीं होता.
Mm-hmm.
You have to spend.
Yeah.
Either you are using, like, you go for medical treatment, you go for surgical treatment, or you are going for hair weaving, you are applying hair patch or anything. हजार
Mm-hmm.
रुपए में hair में कुछ नहीं होता. So
Mm-hmm.
basically क्या है कि there are many treatment options which are available. So depending on the type of hair loss and depending on the demand of patient, we can suggest like what they can use and what they cannot use. So when we were talking about androgenetic alopecia, so there are anti-androgens available.
Mm-hmm.
Usually finasteride and minoxidil are the mainstay of treatment, which is FDA approved. So, and apart from that, there is dutasteride, and there is oral minoxidil.
Mm-hmm.
There are so many drugs available. Then when there are nutritional deficiencies. So
Mm,
there are many nutritional supplements like
mm,
biotin, and
mm,
which contain like biotin is a main component,
mm,
or calcium pentothenate, and different molecules which are grapeseed extract,
mm,
which can promote hair growth, also can stop the graying of hair.
mm,
So these are different molecules, and depending on if the hair loss is associated with in females, if it is associated with PCOD, then
mm,
there are different treatment. In male androgenetic alopecia, there is different treatment. For telogen effluvium, again there are different kinds of treatment. For autoimmune hair loss, there are immunosuppressant drugs,
mm,
uh, like topical steroids and injectable, which we give. Then there
mm,
are calcineurin inhibitor like tacrolimus. So these are
mm,
some of the medical treatment. For surgical treatment, we have like a PRP, where you inject platelet-rich plasma in
mm,
the scalp, and that promotes. They have the growth factor, and then you can get the hair growth. Then
mm,
there is hair transplant also, depending on the, but that is mostly done in androgenetic alopecia, where the medical treatment is not very much effective. First line is
mm.
medical, then second line is surgical,
Okay.
and the surgical treatment is of course more costly, and
Mm,
it is combined with the medical treatment, and so
mm,
you can get a good result from that. Then there
mm,
are different hair weaving techniques like hair weaving or using the artificial hair. So
mm,
there are different kinds of treatment depending on the type of alopecia, age of the patient,
mm,
demand of the patient, or the need of the patient.
mm,
So, but altogether, like, treatment of hair is a long process, and if you need natural hair, you need to give time and you need to spend money.
mm,
And most important thing, you need to trust on your treating doctor,
mm.
because in India, like, everyone is a doctor at home. They suggest you so many things,
Yeah.
but using the things with the scientific evidence is
Mm,
more beneficial for you, rather than using from listening to the neighbor or the friends or cousins, because
mm,
they themselves have never used that things personally,
mm,
and they are suggesting listening from someone else. So that is one of the basic thing, not only in hair treatment, but also with all kinds of treatment which are available.
Okay, that's very interesting. And of course, we should always go to our doctors first and get the root cause, know, and then take the treatment instead of applying anything blindly.
Mm.
Yeah. So, doctor, like now that you said that everyone is becoming their own doctor or others doctor, so there are so many product called nutraceuticals nowadays, which says that eat this and that you'll get your hair back. So, what is these nutraceutical, and is there any role of these nutraceuticals in hair health?
Yes, so I was saying that there are many nutraceuticals in the market also,
Mm-hmm.
like, which contains some of the molecules like biotin or grape seed extract, pumpkin seed extract, etc., and whatnot. I There are many molecules. Like, these are some examples. So we have some scientific evidence regarding that, and
Mm-hmm.
these can of course help in the type of in hair loss. So depending on the, again, we have to look for the type of hair loss, and then we need to give the type of treatment. So nutraceutical is, yes, it is beneficial, but we have to see whether or not it is needed. It's not needed in every patient.
Mm-hmm.
So depending on the type of patient, we can use it.
Mm. Okay. Ah, okay. So depending upon the type of patient, we should use it instead of taking it blindly and making our body.
Yeah, actually, taking anything unnecessary is not good for the body.
Mm-hmm.
and not good for the person's pocket also,
Yeah.
because these are expensive.
Mm,
They These are expensive, and if you don't have the need and you are taking it unnecessarily, you are just creating a financial burden on yourself.
yeah.
So it's better to spend some money on a consultation and save more money rather than blindly using the drugs which are not needed for you.
Yeah, yeah, that's very true. Like after spending a lot of money and getting frustrated, then at the end of the day, you go to your doctor, and then you are frustrated and saying, "Doctor, like, kuch kar do," after like everything has gone. Yeah,
Yeah,
that.
and then those patients don't have money to spend on doctor's prescription,
Yeah.
because they have already spent everything listening to their neighbors and searching on Doctor Google.
Mhm.
So that's a problem, because if everyone can treat their condition reading Google, then everyone would be have been doctors, and our OPDs have been. There would have been no patient in our OPDs. So
Mhm.
the thing is, you taking a good consultation from a qualified dermatologist is
Mhm.
uh, is necessary. Yeah.
Yeah, that's very true, doctor. So, doctor, apart from hair loss, there is another very common problem which is faced by all of us is the dandruff. So, what is this dandruff, and does dandruff cause hair fall?
Yes, dandruff causes hair fall because, see, any pathology or any disease in the scalp can cause hair loss.
Mm-hmm.
Whether it is tinea capitis, that is fungal infection of the scalp, whether it is seborrheic dermatitis, or whether it is in common language dandruff. So dandruff does causes hair loss, and sometimes getting a treatment for dandruff
Mm-hmm.
reduces hair fall.
Mm-hmm. Yeah.
And in many cases, hair fall has been stopped after that dandruff has been tackled properly.
Mm. Yeah. That's.
So it is. So dandruff can cause hair loss.
Hmm. So, even though if you have a dandruff, you need to actually take it seriously instead of making it more worse.
Yeah, because it is actually a time taking thing to get rid of dandruff,
Mm-hmm.
because when you take good medications and use the perfect shampoo according to your hair and use the proper treatment, it goes away. But the patient are frustrated because it come back again.
Mm-hmm.
The
Yeah.
problem is that because their scalp is very oily,
Mm. Yeah.
and some people are also in India, there is a habit of applying a lot of coconut oil, especially in South India.
Mm-hmm.
So the people who are having dandruff and applying the coconut oil uh, creates more dandruff.
Mm-hmm.
That's what I have experienced. So I think that taking it seriously and getting proper treatment for it can reduce further hair fall.
Okay, so doctor, now that you talked about coconut oil, like all our mothers and grandmothers, they have always said that apply oil, your hair will grow stronger and thicker, and it will be like nice. So, oiling hair is boon or a ban? What's the fact behind this actually?
Well, oils actually moisturize your hair and definitely make your hair more thicker, look black, and prevent canitis in some ways.
Mm-hmm.
But depending on what type of oil should be used is important.
Mm-hmm.
And nowadays, many types of oil are available in market.
Mm-hmm.
So there are almond oil, mixed type of oils which contain different molecules.
Mhm.
And then there is coconut oil and different varieties.
Mhm.
But nowadays there are also hair moisturizers, which I feel are better than applying oil. So
Mhm.
it does the work of oil only,
Mhm.
but there are less chances of developing dandruff due to which was developing due to oil.
Mhm. Mhm.
So in my personal experience, I prescribe hair moisturizer to all my patients rather than oiling it. In those patients who are not very prone to dandruff or normal scalp,
Mhm.
whose scalp are dry, they can apply oil,
Mhm.
but
Mhm.
not daily, twice or thrice a week.
That's interesting. So that means that oiling hair can just nourish your hair or help soften the hair, but not promote the hair growth.
Basically, if it is nourishing the hair and it is softening, it's making hair more healthier. Then there
Mhm.
is a less chance. There are less chances that your hair you will have a breakage of the hair.
Mhm.
So that's why it's making your hair stronger.
Mhm. Mhm. Okay, that's
Mhm.
interesting. Very
Mhm.
informative, doctor. So, doctor, we talked about lifestyle, and there is one thing called stress, which is unavoidable by all of us. So,
Mhm.
is there any impact of stress on our hair health, and how can we manage it?
Yes, definitely. I would say like stress is an important part for important etiology, important cause for all kinds of diseases. Not
Mhm.
only hair, skin also, and uh, health of a person also.
Mhm.
So there are like various methods, and like what I was talking about, like 20 to 30 years ago, people had less stress, and so
Mhm.
therefore they had less hair falls.
Yeah.
Like you see people from like that generation, like 30 years ago,
Mhm.
they were not having as much as problem as we have today for hair fall.
Mhm.
So in some ways, like we can say that stress was less in those days.
Yeah.
Office work was less. Everyone was living a slower life.
Yeah.
Even we see people in villages or rural area have less hair fall than
Mhm.
in urban areas.
Mhm.
So the thing is, we have to reduce stress, take proper sleep, proper nutritious diet,
Mhm.
also do some exercise,
Mhm.
or spend some time on your hobbies. And
Mhm.
I think that would definitely reduce stress and would be good for our bodies and also for our health.
Thank you, doctor. Now, my favorite part.
Yes,
Can you give us some important tips for healthy hair?
okay. So, some important tip for healthy hair, which I would like to give is first and foremost thing for hair and skin, drink lot of water, fresh water,
Mhm.
lot of water, and eat all the greens like green vegetables, fruits. So then there would be less of the nutritional deficiencies which people are having these days.
Mhm.
Take proper amount of sleep, take up and then use proper conditioner and a shampoo according
Mhm.
to your hair,
Mhm.
and avoid doing this I always say, if it is not necessary, especially to the females, don't do hair straightening or all the hair procedures which we are doing, like coloring your different uh, like people have been given naturally very beautiful hair, and they try to color it into different colors and indirectly putting some chemical into your
Mhm.
hair, and after some time they say that we are having hair loss.
Yeah.
So I would suggest the natural, the better. And
Mhm.
if you go for any like hair straightening and then something, then there is, it looks good and at the start, but when after some time then starts to break and there is a lot of hair fall.
Mhm.
So until or unless it's very necessary, don't go for all the hair procedures.
Mhm.
And if at all you are having facing any problem like any scalp disease related or hair related disorders, there are lots of good
Mhm.
dermatologists in the country,
Mhm.
and they can help you out, and
Mhm.
they will surely help you out. So
Mhm.
seeking consultation for problem is very important.
Mhm.
And first and foremost, if you are maintaining a good lifestyle,
Yeah.
you won't have the need to take a consultation. But if at all everyone needs to visit a specialist sometime, so if at all there is the hair condition happening, you can anyone can contact like a different dermatologist in the country, a qualified dermatologist.
Mhm.
There are lots of quacks also, but I would suggest consult a qualified dermatologist or a trichologist, and
Mhm.
then seek proper consultation.
Mhm.
Yeah. And then I would suggest avoid taking any unnecessary supplements and unnecessary things which are not needed for your scalp, for your body.
Mhm.
Avoid it, because
Yeah.
people have this tendency that I am taking this supplement because my friend is taking this supplement. Not only for hair, for anything. People are visiting gym these days, and they are like joining the gym and working out for 3 to 4 days, and they start taking any XYZ supplement,
Mhm.
start taking any medication, but without knowing about that supplement,
Mhm.
anything which we don't know about and we are taking inside our body or applying in our face or a scalp is
Mhm.
dangerous in
Yeah.
long term. Yes.
Mhm.
So I would suggest that avoid using these things,
Mhm.
and avoid any hair procedures without any need,
Mhm.
and maintain proper lifestyle.
Mhm.
That's what I would suggest to all my viewers for healthy hair.
Yeah. Thank you so much, Doctor. This discussion was very informative.
Most welcome.
Can I take some live audience
Pardon?
questions? Can
Yeah.
I
Okay.
take live audience questions? Yeah. So the first question from our viewer is, Hi डॉक्टर, मुझे एंड्रोजेनिक एलोपेशिया है। मैं भी बिलासपुर से हूँ। मुझे आपका अपॉइंटमेंट चाहिए। क्या मेरे लिए सिर्फ हेयर ट्रांसप्लांट ही सोल्यूशन है, कुछ और हो सकता है?
तो मैं अभी 5 to 7 क्लिनिक में रहूंगा। 5 तो हो गए, फाइव
हम्म,
थर्टी टू सेवन तो आप आके दिखा सकते हैं, कंसल्टेशन ले सकते हैं।
हम्म,
मैंने आपको अपॉइंटमेंट दे दिया है, आप आ सकते हैं।
हम्म। एंड ही इज आल्सो आस्किंग दैट हेयर ट्रांसप्लांट के अलावा कोई और सोल्यूशन नहीं होता है एंड्रोजेनिक एलोपेशिया के लिए?
बिल्कुल होता है, मैंने बात भी की उसके बारे में कि हम फिनेस्ट्राइड और मिनोक्सिडिल के बारे में बात कर रहे थे, ड्यूटेस्ट्राइड हैं।
हम्म,
तो एंड्रोजेनिक एलोपेशिया में बेसिकली अगर आपके फादर को है, ग्रैंडफादर को था,
हाँ,
आपकी
हाँ,
फैमिली हिस्ट्री रन हो रही है,
हम्म,
तो आपको लॉन्ग टर्म ट्रीटमेंट लेना पड़ेगा।
या,
अब लॉन्ग टर्म में तो इसके लिए पहले आपको विजिट करना पड़ेगा क्लिनिक पे। उसके बाद हम टाइप ऑफ ग्रेडिंग होती है उसकी, जो
हम्म,
7 ग्रेड में वो डिवाइड किए जाते हैं।
हम्म,
उसका क्लासिफिकेशन है, नॉर्वुड क्लासिफिकेशन, तो उसके हिसाब से हमको देखना पड़ता है कि आप कौन से ग्रेड में आ रहे हैं। तो कौन से ग्रेड में आते हैं तो उसके उस ग्रेडिंग के हिसाब से फिर ट्रीटमेंट होता
ओके
है।
ओके, सो आप डॉक्टर को विजिट कर सकते हैं 5:30 टू 7 के बीच में डॉक्टर अपने क्लिनिक में रहते हैं. So you can always visit him and get your treatment start. Okay, another question from our viewer is, hi doctor, मुझे diabetes है and recently मेरे कोर्स में इंसुलिन ऐड किया गया है. जब से मैं इंसुलिन ले रही हूँ मुझे बहुत सारे हेयर लॉस हो रहा है. So is it because of इंसुलिन और या मुझे कुछ और हो गया?
बेसिकली इसके लिए हमको ये भी देखना पड़ता है कि आपका शुगर कंट्रोल में है कि नहीं है।
हम्म
कई लोगों का शुगर जब ज़्यादा हाई हो जाता है या फिर एसोसिएटेड डिसऑर्डर्स होते हैं, जैसे कि थायराइड का भी प्रॉब्लम होता है कई लोगों को, जैसे हाइपोथायरॉयडिज्म में हेयर लॉस
हम्म
बहुत ज़्यादा होता है।
हम्म
विटामिन डी डेफिशिएंसी एक बहुत कॉमन कॉज है इंडिया में।
हम्म
हालांकि सन हर जगह है, लेकिन सन को हमारी स्किन उतना एब्जॉर्ब नहीं कर रही है, हम उतने देर सन में व्यतीत नहीं कर रहे हैं, धूप में व्यतीत नहीं कर रहे हैं।
हम्म
तो पहले हमको कॉजेज देखने पड़ेंगे, ये भी देखना पड़ेगा कि आप पहले कभी अभी 2-3 महीने के अंतराल में बीमार तो नहीं पड़े थे, कुछ फीवर तो नहीं हुआ था, आपकी
हम्म
ब्लड रिपोर्ट सारी नॉर्मल है कि नहीं। क्योंकि
हम्म
हेयर लॉस ड्यू टू इंसुलिन इज नॉट वेरी कॉमन। तो पहले जो दूसरी चीजें हैं उनको
हम्म
हमको रूल आउट करना पड़ेगा, फिर हम बोल पाएंगे कि वो इंसुलिन के कारण से है कि किसी और चीज के कारण से।
हम्म Okay, interesting, doctor. I'll quickly take the last question because we are running out of time. So the question is, hi doctor, my daughter is 12 years old and she's having a lot of white hair, and you said that coconut oil won't work. We were applying that, but nothing happened also. So is there any solution for 12 years old girl not to have white hair?
एक तो आप उसके न्यूट्रिशन पे ध्यान दीजिए कि उसका न्यूट्रिशन पूरा हो रहा है कि नहीं।
Mm-hmm.
आजकल के बच्चे में प्रॉब्लम ये है कि उनके पेरेंट्स उनके डाइट पे ध्यान नहीं देता।
Mm-hmm.
बेसिकली वो फास्ट फूड खाते रहते हैं,
Mm-hmm.
रोज उनको चिप्स, कुरकुरे, चॉकलेट, ये जो डेली की चीजें हैं, तो इससे क्या हो रहा है कि न्यूट्रिशनल डेफिशिएंसी हो रही है। बेसिकली जो कैनाइटिस होता है, जो ग्रे हेयर होता है, वो कैल्शियम पेंटोथेनेट या फिर बायोटिन डेफिशिएंसी से हो सकता है।
Mm-hmm.
तो इसके लिए आप जो भी अपने नज़दीकी डर्मेटोलॉजिस्ट से संपर्क करें, वो आपको प्रॉपर जो है कंसल्टेशन प्रोवाइड करेंगे।
Okay, so there is solution for premature tinnitus, and they can always visit to the doctor. So finally, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
Yeah, I would say maintain a healthy lifestyle, take proper sleep, reduce your stress, and your hair and skin will remain healthy. And that is all what I would like to say.
Yeah,
Thank
and
you.
always go to certified doctors, like you said earlier, instead of
Yeah,
using all these online products.
yeah, that's true.
Yeah. Thank you so much, doctor, for sharing all your
Thank you.
expertise to me and
Thank you. Thank you, sir.
answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. It was delight to have you, and thank you so much for your valuable time.
Thank you. Thank you.
And also, thank you so much, viewers, for joining us today and asking questions and participating so actively. I could not take any many questions, but yes, if our doctor have time, we'll discuss more about other topic on skin and hair conditions and problems and create more awareness and ask all the remaining questions. Until then, doctor, see you soon and take
See
care
you,
and
sir.
have a
Thank
nice
you.
day.
Take care. Have a good
Bye bye, doctor.